annals of medical history, few figures evoke as much controversy and intrigue as Dr. Jack Kevorkian, often dubbed Dr. Death by the media. Born in 1928 to Armenian immigrant parents in Pontiac, Michigan, Kevorkian's life journey would ultimately become intertwined with the fiercely debated issue of physician-assisted suicide. From an early age, Kevorkian exhibited a keen intellect and a deep sense of compassion for the suffering. After graduating from the University of Michigan Medical School in 1952, he embarked on a career as a pathologist specializing in the study of death and its causes. Yet, it was his later years that would thrust him into the spotlight, sparking a national conversation about end-of-life care and patients' rights. Kevorkian's advocacy for assisted suicide began in the 1980s, driven by a belief in the right of terminally ill patients to choose the timing and manner of their deaths. Armed with homemade euthanasia devices, he assisted numerous individuals in ending their lives, often videotaping the procedures to document their suffering and his efforts. His actions ignited a firestorm of controversy. While some hailed him as a compassionate crusader for individual autonomy and dignity in death, others condemned him as a dangerous renegade, flouting medical ethics and the law. Legal battles ensued, with Kevorkian facing multiple charges of murder and assisted suicide throughout the 1990s. Despite facing legal consequences, Kevorkian remained steadfast in his mission, arguing that his actions were motivated by a desire to alleviate the suffering of those facing unbearable pain and terminal illness. His staunch defiance of societal norms and legal constraints made him a polarizing figure, revered by some as a champion of mercy and condemned by others as a dangerous outlier. Ultimately, Kevorkian's legacy is a complex tapestry of moral ambiguity and ethical debate. While his methods and actions continue to stir controversy, his unwavering commitment to challenging the status quo forced society to confront uncomfortable questions about the limits of medical intervention, individual autonomy, and the nature of suffering at the end of life. Love him or loathe him, Dr. Jack Kevorkian remains an indelible figure in the ongoing discourse surrounding death, dignity, and human rights.